morning, class. Welcome to Emergency Medical Services, and our topic for today is C-PAP. I will be your instructor for today. My name is Selena Hernandez. Alright guys, do you have any idea what does C-PAP stand for, or dyspnea? Do you guys have worked with any patients who have shown any those kind of problems? Or do you have any idea what it means? Alright guys, let's get started then. Do you guys know what dyspnea means? Okay, dyspnea is difficulty breathing due to partial or full airway obstruction. Signs and symptoms of dyspnea are shortness of breath. Other concerns may be that it may be caused due to history of breathing problems and as well as heart problems. Any other signs and symptoms of it would be chest tightness, weak, dizziness, headache. You will feel a pain in your muscles when you start to breathe in. Okay, do you guys have any questions concerning dyspnea? Alright, let's move along. Sleep apnea. Sleep apnea is a serious sleep disorder that occurs when a person's breathing is interrupted during sleep. There are two types of sleep apnea. If sleep apnea is left untreated, it means that you will stop breathing during your sleep. It also means that the brain and body may not get sufficient oxygen. Alright, let's move along to two types of sleep apnea. They are obstructive sleep apnea, which is the most common sleep apnea, and it is caused by blockage of the airway, usually when the soft tissues in the back of the throat collapse during sleep. The other type of sleep apnea is central sleep apnea. The airways is blocked, but the brain fails to signal the muscles to breathe due to the instability in the respiratory control center. If it is left untreated, it can result in a number of health problems such as high blood pressure, stroke, heart failure, irregular heartbeat, diabetes, and depression. Do you guys have any questions concerning sleep apnea and the two types there are? Okay, let's keep moving along. Alright guys, do you know what C-PAP is? Can you give me any idea? What do you think it stands for? How would you use it? Okay, C-PAP stands for Continuous Positive Airway Pressure. It's a treatment that delivers slightly pressurized air during the breathing cycle. It keeps the windpipe open during sleep and prevents episodes of blocked breathing in persons with obstructive sleep apnea and other breathing problems. C-PAP is usually used mostly for people with obstructive sleep apnea, as well as patients with acute respiratory failure, central sleep apnea, COPD, and heart failure. Alright guys, do you have any idea what kind of patients should use C-PAP? Such as, let's see, a person who's suffering shortness of breath, or a person who has an asthma attack, or a person who has heart failure and can't breathe. Okay, who should use C-PAP? C-PAP is best used treatment for people who have obstructive sleep apnea, central sleep apnea, acute respiratory failure, COPD, and heart failure. This device is useful for adults with collapsible airways, as well as people who have small lung volume, as well as muscle weakness that makes it difficult to breathe. Do you guys have any questions? Let's keep moving along. What is the most common use of C-PAP in the field? In the field, you may experience many types of respiratory problems, but typically the main ones that are usually are people who have COPD and people with heart failure. The type of patients we mainly use it are for COPD, which stands for chronic obstructive pulmonary disease. It's a mixture of two diseases. They are chronic bronchitis, which means the airways that carry air to the lungs get inflamed and make a lot of mucus. The other type of disease that makes it is emphysema, which means the air sacs are damaged and lose their stretch. Less air gets in and out of the lungs, which makes it for you to feel short of breath. And over time, COPD gets worse. COPD is almost always caused by smoking. The breathing in of tobacco irritates the lungs, and it also destroys elasticity in them. The other things that put you at risk are chemical fumes, dust, air pollution for a long period of time, and also secondhand smoke. So if you guys are around people who smoke a lot, or let's say if you have worked in a place where there's a lot of smoke always coming in from factories, or maybe it's hereditary and you have asthma and it gets worse over time, and these kinds of factors make it worse for people who have COPD and trigger a lot of health risk factors. Okay, do you guys have any questions concerning? No? Okay. How does C-PAP work? Do you guys have any idea how does the C-PAP device work on the patient? How do they feel? How does it improve their breathing rate, their oxygen saturations? Okay, it is designed to keep the windpipe open. It consists of a mask, a tube that connects the mask to the C-PAP device, oxygen, it contains head straps, and C-PAP works by steadily increasing the pressure in your airway. The C-PAP device does not breathe for you, so don't tell the patients that this device will breathe for them. It helps them improve their breathing. So it creates a flow of air pressure when you inhale that is strong enough to keep the air passages open. Do you guys have any questions? No? Let's keep moving along. The advantages of C-PAP. The advantages are that it keeps the airway passages open, as well as it prevents pauses in breathing. It reduces fatigue, blood pressure, heart disease, diabetes, and stroke. The advantages are that it makes it easier to breathe. It will also reduce their breathing rate and rhythm. Their vital sign changes will occur, so it is crucial for you to reassess the patient and monitor them at least every 5 minutes, because anything can go wrong. The patient may deteriorate more, and you'll probably, best way to do it for them is intubate. The disadvantages of C-PAP are the patient will have mask discomfort, they'll get nasal congestion, their nose and throat will get dry, you'll have runny nose, sneezing, irritation of the eyes and skin on the face, as well as abdominal bloating, and leaks may cause the mask to not fit properly, so it really makes a big difference when the mask is properly sealed as when it's not. So if the disadvantages would be that the patient will start to feel uncomfortable at first if it's the first time using this device. So it is very important for you to coach them on how to use this device, because if you don't, they'll try to take this device off and you'll have to start all over again, a different process, and it's going to take even longer for them to receive proper treatment, and it can get worse for the patient as well as for yourself. So it is crucial for you to keep coaching the patient on breathing and help them stay calm. Do you guys have any questions? Okay. How to relieve the side effects. You have to make sure that there's a proper placement of the mask. You don't want any leaks coming out of the mask. You want the patient to receive the full 100% oxygen coming in, so their windpipe gets open and they receive enough elasticity in their lungs. Use a humidifier or nasal spray medicine to reduce nasal irritation and drainage. So you really want them to have some kind of good medical devices at home that would help them with the side effects of the C-PAP device afterwards. If the side effects get worse, it is best for them to let them know to consult their doctor and see what other methods they can use to relieve those. Do you guys have any questions? No? Okay, let's keep going along. How to identify the dyspneic patient. What are the first signs and symptoms you can look for in a patient who is suffering from respiratory distress? So the main thing to look for are skin color. If you see their skin color is changing, as well as you see blue or grayish discoloration in their skin, cyanosis around their lips and face,